What does heart failure mean?
So when someone comes back, perhaps having had their ultrasound scan, their echocardiogram, and been diagnosed with heart failure, the first thing I think is to explain what heart failure is, which is to emphasise that it's simply that the heart, is not pumping as well as it should. But then to go on and explain a little bit about the condition. It's a condition at the moment we can't cure, but we can treat. And the aims of treatment to make sure that symptoms are controlled, the quality of life is optimised, and people's longevity, life, is prolonged. And for me, it's about learning how to live with your heart failure rather than being burdened by it or burdened by the treatment. The treatment is there not as an end in itself, but as a way to enable you to live as full a life as possible.
What caused my heart failure?
There's different causes for heart failure, so your doctor will explain to you what caused it in your case. The most common cause is coronary heart disease, and most people don't know that they've had that until they've either had an episode of angina or until they've had a heart attack. But other causes are also high blood pressure and also valve disease, one of the valves in the heart being diseased.
Identifying the cause of heart failure is important because treating the cause can be just as important as treating the heart failure itself. For example, lowering blood pressure if the blood pressure is too high.
How is this going to affect me? Will I always feel like this, or will I feel worse?
When you're first diagnosed, you probably do feel very unwell, and it's natural to assume that you are going to continue to get worse. But our aim initially would be to actually get you feeling better. And there are medications that can be prescribed and increased in dose. And if you tolerate them, you can actually start to feel a lot better and your symptoms will improve.
Why do you want me to increase the dose of medication? I feel fine now.
We know from the evidence that getting people onto the maximum tolerated dose of beta blockers, essentially, but some other drugs as well, such as ACE inhibitors, is not only good in terms of symptomatic relief now, but it'll prolong their quality of life and mortality as well. So what we're trying to do is to get them onto the most effective tolerated dose. So that's why the dose is pushed up by their doctors or nurses.
I don't want to take a beta blocker. Last time I felt dreadful.
Beta blockers, they don't have the greatest publicity, and they do have side effects that can be quite unpleasant initially. But we'll always encourage you to continue with them, because if you can get past the first week or so where you feel very tired, they actually start to make you feel a lot better, and they allow the heart to not have to work so hard, which is obviously a benefit when it's not pumping as well as it used to.
So what I do if people are getting side effects from the beta blockers is to talk about it, to make sure that it is the tablets, because sometimes they could be experiencing side effects which are not due to the pills. And then you've got a number of options if people are feeling rough on the pills, and that is to reduce the dose and then slowly titrate back up, or change to a different medication. So the main thing is, if you are getting side effects with your pills, talk to your heart failure specialist nurse or doctor about it. One of the side effects from beta blockers that can present is impotence, erectile failure in men, and that can be a big problem. And I suspect it's underrepresented because a lot of men are too embarrassed to talk about it. But it's well recognised as a side effect, and we can do something about it. So the key is to be aware that this is a potential problem. And if you are affected by impotence with your beta blockers, talk to your GP about it. And then again, it's about getting the balance right between the benefits of the beta blockers with regards to your heart failure versus the side effects. And if you are having side effects of impotence, you can get treatment both in the surgery and also from specialist urological departments at the hospital. So maybe the GP could refer you on for specialist treatment.
Can I stop weighing myself every day? It's always the same.
Weighing yourself daily is really important. It acts as an early warning sign to you that your body might be beginning to retain fluid. It's actually a really good sign if your weight isn't going up, because if your appetite's stable, that's telling you your body isn't retaining fluid and your heart failure's stable. Fluid retention can come on really quickly and your weight may go up by 4 pounds in only a couple of days. If you stop weighing yourself, you won't pick up on that change in weight, and thus treatment won't start as quickly to help correct it.
What if I get breathless and I can't get hold of my GP?
When you've first been diagnosed with heart failure and you may not have had any episodes of breathlessness before, I would always advise you to either if you can't contact your GP, contact the out-of-hours service and let them know what your condition is and what medications you're on. But if you're under the care of a heart failure team, be it a nurse or a consultant, they will put a plan together with you for what you should do if you get breathless.
If you're desperately short of breath, you may need to consider dialing 999. In either way, while you're waiting, you might find it easier to sit up in a really comfortable chair or sit upright in bed, and sometimes having moving air across your face from a fan, an open door, and an open window might make you feel less breathless.
I have a pacemaker and I'm worried that it'll stop working.
It's quite natural to be worried when you have a pacemaker that it might stop working, but I think you can be really reassured. Modern pacemakers don't stop working. If you go for your regular checks, the information the technician gets from the device will tell the technician how much life the battery has left, and it always gives lots of warning, and your device will be replaced well in advance of the battery stopping.
I'm the main carer for my mum. Would I still be able to look after her?
If you would like to carry on as a main carer, there's no reason why you can't do that. And if that's something that's important to you, we'd like to support you with that. But what we would do is assess the situation and see how it affects you physically and emotionally, and see if we can provide you with any help in that role.
Other things that can really help you remain the main carer are having equipment to help you. It can be simple things like a walking frame or walking sticks, to other things such as the provision of a wheelchair. It's also worth asking if you're entitled to any financial benefits, as many patients with heart failure will be. If you can't work, you may also be entitled to receive benefits.
Can I go on holiday? Is it all right to fly?
Holidays are so important to get a break and recuperate, but there are some things you need to think about. Firstly, what physical activities you're doing at home and what you hope to do on holiday. It's no good finding accommodation up a hill if you struggle to walk up a hill because you're breathless. So you need to think about where the accommodation is. Does it have a lift? Does it only have steps? How are you going to get about while you're on holiday? Is transport available? Other things to think about are the temperature. Are you going somewhere very hot or cold? Because that might aggravate your heart failure. One very important thing is about having travel insurance. Now, some people find it really hard to get travel insurance, but the British Heart Foundation website has a really good list of insurance companies that will provide cover. If you don't have access to the internet to look that up, then ring the Heart Helpline and they'll give you that information. Flying for most patients with heart failure isn't a problem. If you don't have symptoms at rest, then because the cabins are pressurised, you won't get short of breath when you're in an aeroplane. Perhaps the biggest consideration is how you're going to get around an airport and whether or not you might need help because of the distances you might have to walk and help with your baggage.
I really enjoy my job. Would I have to give up work?
Once you are on the right dose of the medications for your heart, you actually might feel a lot better and might feel able to go back to work. So although we may not be able to say at the moment, in the future it's certainly a possibility.
You may have to continue some changes to work depending on the physical nature of the work or how draining you find it. So most patients can continue working, but they might reduce the length of time they're at work each day or reduce the number of days they work each week. There are some jobs that you can't do with heart failure. If your job requires you hold an HGV or PSV licence, you won't be able to do these jobs. One thing that might help with increasing your physical ability at work is to join a cardiac rehabilitation programme, as this can increase your strength and energies to do work.
Who will help me to cope? Will I always have to go to hospital?
There are lots of people who will be able to help you cope with your condition. It partly depends on the services available in your area, but undoubtedly the GP and a hospital consultant, and in some areas a British Heart Foundation heart failure specialist nurse will be there to help you and guide you along. In addition, you might be encouraged to attend a cardiac rehabilitation programme, and that can make a really big difference to your progress.
The aim would be to keep you out of hospital, even if you did have an episode where you didn't feel as good as usual. We would always recommend that you start by contacting your GP or heart failure nurse if you have one, and they will try very hard to keep you out of hospital, and it is possible that they can do that. So you don't necessarily have to be admitted to hospital.
Will I always be able to stay at home?
So for people who've got very severe heart failure and perhaps it's causing them to be housebound, they can't get out very much, a lot of patients will then want to have a conversation about what's going to happen in the future. And they worry about having to either move to a nursing home or a hospital, but at the same time they don't want to be a burden both on the family or the health services. Actually, they often say to me they don't want to be a burden. I think the key is to have a discussion earlier rather than later about what people's preferences are in terms about where they want to be cared for if their condition gets worse and how they want to be cared for. And then it's only by having that conversation that the services, and it's not just health services, it's often social services as well, can then meet those needs. It's only by knowing what people want, and the only way you can find that out is by talking about it, that you can meet their needs as best you can. So, as ever, talk to your doctor sooner rather than later about the symptoms, and then you can plan ahead.